I'm with, oh yes, we're recording. I'm Cindy Berry. I'm the Program Director for Early Childhood Professional Learning, sometimes referred to as ECPL. Welcome to our, I think it's our third admin forum session, if I'm counting correctly. Jenny's saying yes. Welcome to our third admin forum session. We're glad you could join us on this very cold Wednesday. We just have a few announcements before we get started, and that is we would ask all of you to keep your microphones muted during the session. There will be chances and opportunities for you to engage in polls. There will also be, you can also put your questions in the chat. We're going to monitor that chat as best as we can with the number of participants we have in today's session. And if we don't get to your questions immediately, we'll try to get to them at the end. So with that, I'd like to turn it over to our Illinois State Board of Education Early Childhood Principal Consultant, Jenny Metcalf, to do the intro for this session.
Hi, everybody. Great to see you all today. Thank you, as Cindy said, for joining us for our third session virtually this year. I again work with the Illinois State Board of Education in early childhood. We are excited today to have Christine Brambilla from the Governor's Office of Early Childhood Development to talk about infant early childhood mental health consultation. As many of you probably know, mental health consultation is a required component of the Preschool for All expansion grant, and it is a highly recommended practice in Preschool for All. So we hope that this session will help you understand a little bit more about how this important role can impact your programs. So with further ado, Christine, thank you.
Thank you so much, Jenny and Cindy, for that warm welcome. And so I'm so honored to be here with you all and with this packed virtual rooms. And thank you so much for giving us some of your very precious time during the day today. So the title of our presentation is Seizing the Moment, Infant and Early Childhood Mental Health Consultation in order to recharge your early childhood staff. So with that, let's get started. I wanted to take a moment before I begin my presentation to ground us in some reflective thinking. And with that being said, Native American tribal elders across several cultures have long linked health with these four simple questions. They believe to understand problems with one's well-being, we must first ask the unwell individual, who are you? Where did you come from? Why are you here? And where are you going? On an individual level, tribal elders believe our health or well-being is linked to the stories surrounding our lives. So, who are we? And what might be some of the lenses with which we see and experience the world through? And once again, my name is Christine Brambilla, and my preferred pronouns are she, her. I am the Infant and Early Childhood Mental Health Consultation Manager with the Governor's Office of Early Childhood Development. I identify as multi-ethnic. My family is Polish, Irish, German, and Mexican American. I present as a Latinx, cisgendered woman. I did not grow up speaking Spanish, but I learned Spanish as a result of my education and study abroad experience. I am a disruptor of intergenerational poverty and trauma that my mother and grandmother have survived. I am a mom in a blended family. I have two sons. One is a Spanish dominant preschooler with an IEP, and I also have an 8th grader that is navigating middle school and is excited to transition to high school. Where did I come from? I was raised on the south side of Chicago in a predominantly African-American community. And my first out-of-home educational experience occurred at a community-based preschool program, similar to some of the programs that you may lead in this room. And why am I here? I was invited by a retiring colleague, Linda De La Mata, who is a well-respected national leader in the field of infant and early childhood mental health consultation. And she referred me to Cindy at ECPL and invited me to join you to share a bit about infant and early childhood mental health consultation. And my goal is that I'm here to empower you with knowledge, to enhance your early learning programs, and to partner with you in order to promote equity in your early learning programs. I hope to partner with you to support young children as you continue to foster a love of learning. So with that, let's briefly review the agenda. And so for our conversation today, we'll talk about why now. We will review some legislation that has recently passed in the spring last year and some program guidance that was created in partnership with ISBE. Another thing we will talk about today is exploring what infant and early childhood mental health is and how it can impact preschool expulsion, suspensions, or transitions. We'll also discuss a little bit more about the Illinois model of infant and early childhood mental health consultation. We will learn a little bit more about what the current research says about infant and early childhood mental health consultation. And then we will help you understand where you might be able to find a mental health consultant in your community. So with that, we will launch our first poll. And so I wanted to get a better understanding about who's in the room with us. So what program do you represent? Do you represent a preschool for all program, PFAE program, a prevention initiative program, or is it another type of program? And if we haven't captured your program, then please feel free to put that in the chat. And all this information would help us adjust our remarks so that we can make sure that we are accommodating and speaking to the type of program that you are joining us from. And you all are doing very well with participation rates, so I'm so excited. I have engaged learners today. All righty. So I think we have a strong representation. So we have about 77% with PFA. We have about 52% PFAE. And then we have about 29% for PI. And then we have about 13% other. So I'm just going to click over to the chat. And it seems like we have some private preschool programs, tuition-based programming in Title I. We have some private non-for-profit preschools, and a child care director for center-based program, perfect, blended preschool, private preschool and child care, and researchers and early intervention. Welcome. All right, and so we can share those results, and then we will get into the second poll. All right. So the second poll, we wanted to learn a little bit more about where you're joining us from. So would you self-identify as joining us from the northwestern part of the state, the northeastern part of the state, central, southern? And again, this helps us during some of the later parts of the conversation to shape where you all might be joining us from. It's a great mix here. Great. All right, with about 92% participation rate, we have about 24% from the northwestern portion of the state, about 28% from the northeastern part of Illinois, and we have 30% from central Illinois and about 18% representing southern Illinois. And I promise one last one for this portion, and I will get back into the content. But you didn't think you were gonna come to a pop quiz today, so thank you so much for indulging us in this conversation. And all right, finally, if you could share a little bit more about your role. Are you an administrator? Would you identify as a principal, as educational staff, family support, or other? And again, I would invite you that if I did not capture your role accurately, please share with us in the chat what that might be. I know I saw early intervention listed and researcher. And thank you so much for acing this pop quiz. Instructional coach, thank you. Okay.
Like also coordinator, program coordinator, teacher, consultant, mental health consultant, researcher, social worker, owner, admin, IECHM consultant, MH consultant.
Mhm. I wonder what an AP is. I haven't heard that acronym yet.
An assistant principal.
Okay, thank you. All right. Wonderful. So we do have about 55% administrators, 13% principals, 11% educational staff, 8% family support, and about 20% other. So I'm so glad that we have such a diverse group. And thank you so much, Christy, for your assistance, PFAE program support specialist. Perfect. All righty. Well, thank you so much for indulging me in that poll. And let's get right into the content. So thank you so much for your patience. So now we are going to just delve right into the conversation. And so we'll figure out why now. And so with that, let's understand a little bit more of the recent legislation that passed during the last spring session. So the Education and Workforce Equity Act, PA 101-0654, passed in the spring session. And in alignment with collective support from elected leaders, advocates, and stakeholders, the Illinois Black Caucus introduced and passed legislation with Governor Pritzker, which Governor Pritzker signed into law in early 2021. The Education and Workforce Equity Act signifies broad public support for providing social, emotional strategies and supports that are just as important as for young children as learning their ABCs for our state's youngest learners. This pandemic has amplified the number of children who have experienced childhood trauma and highlighted pre-existing inequities in our school disciplinary practices, and that disproportionately impact Black and Brown students as young as 2 and 3 years old. Access to infant and early childhood mental health consultation is critical to ensure that social and emotional well-being of the state's youngest children are met. And this is particularly important for those children who have experienced trauma and for the workforce that cultivates a child's love of learning outside of the home. The governor approved the allocation of the governor's emergency education relief funding, Gear 2, for the elements to support the elements of the Public Act that calls for supports across the continuum for infant and early childhood mental health. We continue to reinforce that infant and early childhood mental health consultation is intended as a prevention and promotion-based support to the early childhood workforce. However, we also have to invest in the continuum of intervention supports in infant and early childhood mental health. So with that, I also wanted to share with you an opportunity that we co-created with Jenny as well as Penny, some of our principal consultants with ISBE, and we co-created a document about reviewing the learning renewal efforts. That was the learning renewal document that was co-created and released with the P20 Council in Illinois. And as you will see in that document, number 7, the principal really talks about investing in infrastructure for mental wellness and trauma-informed, culturally responsive schools, including educator, professional development, and support. Additionally, the Learning Renewal Effort document, guidance document that was released last year also discusses specific opportunities for reflective consultation, providing job-embedded professional development opportunities, and further outlines and underscores that infant and early childhood mental health consultation is an allowable expense. And as you will see, this document that's also highlighted on your screen to the right is an excerpt of this guidance document that is published on the GOECD's website, specific for infant and early childhood mental health consultation, but it was also distributed in the superintendent's newsletter over the summer. And again, we're so grateful for ISBE's partnership and support to continue to enhance and invest in infant early childhood mental health consultation. In addition, this is also something that was distributed in your materials in preparation for the session today. So with that, I also wanted to share a little bit more about some of the work with, with some of the work of the Governor's Office of Early Childhood Development. So with regards to the system of support for infant and early childhood mental health consultation, GOECD really serves as the facilitator of the statewide leadership team for mental health consultation. So we convene partners from home visiting, independent consultants, early intervention, Head Start partners, preschool partners, our representatives from ISBE, active consultants, center-based directors, and just a whole swath of individuals to really have a concise effort to really think about some of the cross-systems implications about mental health consultation and what we can do as a state to really promote the Illinois model of infant and early childhood mental health consultation. At GOECD, we currently also promote awareness of infant and early childhood mental health consultation. We are engaging in a public awareness campaign so that we hope to generate content to continue to support fact sheets, videos, and additional content that would really speak to what do program administrators need to know about mental health consultation? What should parents or family members know about mental health consultation? How does this differ, or how does this approach more curtail towards home visiting programs? And so we're going to be working on that. And so some of those documents will be ready throughout the course of the year, but definitely finalized at the end of 2022. In addition, we also attend statewide policy meetings to advocate for the inclusion of infant and early childhood mental health consultation into some of the cross-systems work. And as we think about expanding the role of preschool for all across the state, we want to ensure that there is equitable investment in some of those professional development and systems of supports that are just as critical for our educational staff, our administrators, and our children to ensure that they can feel confident and competent and continue to feel invested and supported in their roles. And in addition, we continue to collaborate with state agencies to enhance and promote infant and early childhood mental health consultation within the different programs and funding streams. Now, INCRA, the Illinois Network of Child Care Resource and Referral Agencies, serves as more of our professional development partner. And so they also offer the orientation to the Illinois model, which I'll get into a little bit more, but this orientation really serves as an opportunity to ground the consultants that are currently practicing in the state. And we have individuals that attend that session that are exploring, maybe recently that have graduated from grad school and that are interested in learning more about mental health consultation. And we also have individuals that have been providing consultation for 10, 15 years that join us at this orientation. And it really provides a rich experience to really learn and collaborate across programs, to share a little bit more about their experience as consultants and how we can continue to enhance our practice. INCRA and GOECD also co-facilitate quarterly calls for mental health consultants. So if your consultants are not aware or are not joining us for our quarterly calls, please follow up with me and I'd be happy to connect with them. This is an opportunity for other consultants to collaborate with one another to learn more about professional development opportunities that are available across the state, and for an opportunity to really share some of the program enhancements to the Illinois model, what the research says, and an opportunity to just network with one another so that they don't feel as isolated as they may be if they're an independent consultant, but it's really to join with this community of mental health consultants. In addition, they offer on-demand training. So we continue to, the science about child development, infant early childhood mental health continues to evolve, and we want to ensure that our workforce has the most up-to-date and recent information to continue to enhance their learning experience from the orientation. We also offer reflective learning groups that meet on a monthly basis. And again, this is an opportunity for all consultants across the state, regardless of funding stream, to join us at reflective learning groups. And this is an opportunity where consultants can gain CEUs should they be eligible and need them, but it's also an opportunity for them to have an experienced facilitator meet with them, provide reflective supervision, and also an opportunity for them to really explore and go deep into their work and understand what are some of the implications, strategize with other consultants, and really have that one-on-one support. Whereas a consultant that might be embedded maybe in other settings where they don't have a reflective supervisor, but they maybe have an administrative supervisor, this would be a really good space for them to really continue to grow and to cultivate some of their clinical skill sets within these reflective learning groups. And then finally, INCRA also hosts the statewide consultant database, which I am so excited to show you. If you have not visited it yet, we will be showing a demonstration later on during the presentation. So part of this conversation, I wanted to share a little bit about it to ground us in what are some of the core principles around infant and early childhood mental health. Infant and early childhood mental health is developing the capacity of a child to form close and secure adult and peer relationships. It's the ability to experience, manage, and express a full range of emotions. And it's also the ability and willingness to explore the environment and learn. This is all based within the context of family, community, and culture. An infant and early childhood mental health consultation is under this umbrella of infant and early childhood mental health. And so we continue to borrow from that principles and really thinking about some of the developmental supports we need to provide for our youngest learners, but then also taking into context the child's mental health and well-being and what you can do as educators, as principals, as family support staff, what you can do to contribute to support infant and early childhood mental health, because this is really a community approach and we all support little ones that will grow into our future leaders. And as you can see also in this graphic, we include pediatric healthcare, we include early care and education staff, we include home visitors, public policy, child welfare, and early intervention as we think about it, because there is something that everyone can really do to continue to build and support the infant and early childhood mental health. So some of the research in why this matters, we really wanted to look at how experiences early on can impact how our children learn. And unfortunately, some of the research can be startling when we talk about preschool expulsion and suspension. What we know is that young children under the age of 5 are 3.5 times more likely to be expelled from preschool programs than the K-12 population. We also know that young children that are expelled or suspended as young students are 10 times more likely to drop out of high school and experience academic failure and have negative attitudes or perceptions towards school. And young children that are expelled or suspended are 8 times more likely to be incarcerated later in life. And so those statistics are a little startling, and we have made some progress, especially here in Illinois, but this is a practice that continues to be present, and this is something that we continue to work through and think about how we can invest in our systems to alleviate some of the pressures with which children experience expulsions and suspensions at a young age. So something else for you to consider as we think about infant and early childhood mental health is that our youngest learners might not necessarily have the words to express their needs. And again, as a parent who has a child with an IEP that is Spanish dominant, I'm very conscious of what the research says about our young children, specifically my young child, who is bigger for his age. He also has an IEP, and he also is an English learner. So there's a lot of supports, and I'm very intentional about my ability to communicate with his preschool teacher, but also to communicate and advocate for his needs so that we can ensure a positive learning environment, but then also to maintain those open lines of communication should something arise in the class, or if there's something else I can do as a parent at home to support his learning. So with that being said, sometimes this looks like infants and young children lack the words to express and feel that they're overwhelmed. And and we see that with the course of temper tantrums. Why is there this disconnect that every time this child around snack time just really falls out and just has a really terrible time with transitioning to the next activity? And while we're understanding that you have a classroom of maybe 19 other students that you need to transition them to the next activity. Another consideration is that children can be labeled as defiant or too quiet or naughty or overly clingy. And yet, with the help of mental health consultation, we can explore what they're telling us through their behaviors and how they might need our help, and continue to explore what are some of these precipitating incidents that might kind of trigger this strong reaction from our youngest learners. And it can be also hard to know the best way to respond when a young child is having a hard time, and all we want to do is just soothe them and also help them work through some of their big feelings and help them express and communicate their needs to us so that we can help them engage in their environment in a safe way and in a supportive way. The next thing I wanted to talk to you about is why we need to support our caregivers and provide them with the tools and the support they need for our little ones. So child care providers, home visitors, preschool teachers, families, and communities could use more training and support to address infant and young children's social and emotional needs. Yet preschool teachers, for example, don't have adequate support in order to feel that they can be supported in navigating some of these tough situations. Based on some of the research, only 1 in 5 preschool teachers have received specific training on facilitating children's social and emotional growth in the past year. Only 34% of teachers believe that they have the necessary skills to meet their students' mental health needs, and only 23% of preschool programs have on-site or scheduled visits from mental health professionals. And again, I would want to pause and say that mental health consultants are part of this continuum of support, but there are opportunities with which we may need to connect young children and families with some of those more long-term ongoing supports within their communities so that they can receive assistance in navigating some of the family challenges that we know has arisen during the time of COVID. The next part I wanted to share with you is this slide, and I've alluded to this in other parts of the conversation, but I really wanted to take a moment and pause with this slide to really show the different spheres and opportunities and locations with which mental health consultation can occur. And as the title of this slide says, that it is available where young children learn, grow, and play. And Illinois is one of the few states, so it is the leader in the nation with where they offer infant and early childhood mental health consultation services. And it's available in multiple systems that serve children and families. It's available with child care programs, home-based as well as center-based programs. It's available in early intervention through some of our social emotional consultants, as individuals have described in the chat. It's also available in early Head Start and Head Start programs, as well as present in our ISBE PFA, PFAE programs, as Jenny shared with us at the opening of our conversation. And it's also available to support home visiting programs that are supported by DHS, Prevention Initiative, as well as McPhee. And there are also independent consultants that work across various funding streams and support a variety of programs. And this continues to underscore the work of GOECD as well as INCRA and recent evaluation efforts by Chapin Hall to measure the fidelity and implementation of the Illinois model that allows for flexibility in the various environments where young children learn, grow, and play, but also meets the local context of programs as they continue to support young children in their early learning. Oops, I'm so sorry. So with the next slide, I'm going to take down my PowerPoint, and we're going to watch a very brief video, I promise. So with that, I will turn it over. There you go. We can't hear the sound. Susie, we can't hear the sound.
Okay.
And I would also
I could hear the sound at this end, but I will try and start it again in hopes that everybody will be able to hear it. Sure thing.
Thank you, Susie. And one more thing, if there are questions that come up for you, please enter them into the chat. We would be happy to answer them or embed them in some of the comments that we may have. So please don't be shy about sharing some of the questions that you may have. Susie, we still don't have it.
Susie, somebody wrote a suggestion in the box that you have to click share before you start the video. Or share sound, I think it says.
Yeah, my apologies. I'm hitting the share and I'm going.
We promise. We tested it out and everything before you all joined us.
We tested. All right, we'll try one more time. It does, however, have subtitles. So if you're able to see the video, hopefully you should then. Are you able to see the video? Is everybody able to view it? Can you not?
Mm-hmm.
Yeah. Okay. So hopefully then you'll be able to see the subtitles. So it's showing that. So hopefully you'll be able to follow along. We'll try it one more time.
There are some suggestions coming into chat, like did you check the actual volume of the video on the video or share in a tab? Maybe try play without muting yourself and also make sure you're not wearing headphones. I don't know if those are applicable.
Yeah, no, I don't have headphones and we did test it before and it worked, but I will try without muting myself. Thank you, everybody. I appreciate the suggestions.
You all are such a great can-do team, troubleshooting. I really appreciate the feedback and the camaraderie. Thank you all.
Infant and Early Childhood Mental Health Consultation is an evidence-based approach that improves child behavior and development through partnering mental health professionals with early childhood providers and families. Outcomes and impacts found through rigorous studies show that infant and early childhood mental health consultation is effective. The political will is here. 3 Department of Health and Human Service agencies have come together to create a center of excellence to promote the adoption, expansion, and sustainability of infant and early childhood mental health consultation. The Center of Excellence is based upon the work of dozens of experts in the fields of early childhood development, children's mental health, early education, and health disparities. We know that the social and emotional health of young children is linked directly to school readiness and achievement, relationships with peers, and positive long-term health outcomes.
So we know that it works to provide mental health consultation to early childhood programs and that it has a positive impact on what's going on with children. So I think now is the time to take what we've learned, what the science says, what the research says, what the data says, and make that happen everywhere for all of our children.
This is a very exciting time for HRSA to partner with our sister agencies of SAMHSA and ACF in this creation of the Center of Excellence on Infant Early Childhood Mental Health Consultation and this toolkit. This represents the first time when these three organizations have come together, specifically committed to infant and toddler social-emotional relationship and parent-child relationship quality, activities, and improvements.
We know that if we're able to get children developing in very healthy ways early on, if we're able to make those tweaks early on when children might be developing early symptoms or having struggles early on, we can get them on a trajectory of success rather than a trajectory of struggling with mental illness and substance use disorders later on in life.
And once again, thank you all for your assistance with troubleshooting with us to ensure that we could get this video going. And so with that, we will jump right back in with another pop quiz. I promise, last one for your consideration. All right, so we just wanted to get a feel for this room to understand, have you partnered with an infant early childhood mental health consultant? And so the possible answers are yes, no, I don't know, and we have in the past. And I also did see Melanie's question in the chat, so we will be getting to that about how to connect with the mental health consultant later on in the presentation. All righty.
Christine, comments are also coming in that there is one on staff for one of the individuals, and that we have one at the district social worker provides it for another one.
Okay, wonderful, thank you. So some program embedded ones, okay, as well, in the school social work. Okie dokie, thank you. All right. So with that, I think we have about 82% and participation. So we have about 59% yes, and then about a quarter no, and then 15% in the past, and then 1% unsure. All righty. So with that, let's continue to move on through, and thank you so much for sharing. Alrighty, so the next portion, we wanted to delve into how does the Illinois model of infant and early childhood mental health consultation, what is unique about it? And again, as we talked about earlier in the presentation, it's really focused about more of the promotion and the prevention piece of it. Although there are times in which mental health consultants can offer some suggestions about interventions and strategies, but really when you have more of a complex case, or you've been working with a child or maybe staff member, or if there's bigger needs, there may be an opportunity with which your consultant can support you with reaching out or branching out to some of the other community-based resources, but that is something that we continue to support consultants in continuing to reach out some of our other professional development partners, understanding when the pyramid model might be more of an appropriate fit, understanding with which we might partner with StarNet to understand a little bit more of some of the child's learning needs, and some of our other professional development partners where mental health consultant isn't necessarily the end all be all, but they can be a part of this team of professional development supports that we offer our educational staff as well as our administrators and our family support staff. So consultants partner with the early childhood workforce, and it is a multi-level proactive approach. I'm sorry, if you're speaking, could you please go on mute? Thank you. And it's multi-level, it's a proactive approach, and it focuses on supporting and enhancing children's social emotional development and promoting the overall staff well-being of staff. Infant and early childhood mental health consultation is not about fixing the child. It is primarily an indirect support, meaning that the adult is typically the focus of consultation and primarily engages in the work with the consultant. Infant and early childhood mental health consultants also collaborate across the continuum with multidisciplinary professionals who work with young children and their families in a wide variety of settings. They promote reflective practice and the enhanced capacity of adults to respond to challenging situations as they navigate and work through the COVID pandemic. Next, we would also share that infant and early childhood mental health consultants help educators support the healthy growth and development of our young children. They promote strong relationships in supportive environments for early childhood educational professionals, along with families and communities. They partner with adults to understand what young children are telling us with their behaviors and help co-create situations. This is not a situation where you have an external expert come in and tell you how to fix what's going on in the classroom. This is really tapping into understanding what is the context, what might be some of the considerations that we haven't thought about yet. This is an opportunity for us to really take a step back, to see the forest through the trees, and really engage in some reflective consultation to understand what else might be going on that impacts this learning environment that we're trying to cultivate in this environment. With that, we also equip early childhood professionals with the tools and insights to develop healthy emotional and social behaviors with young children and to help our children feel safe, supported, and valued. This next diagram really comes from the Center of Excellence for Infant and Early Childhood Mental Health Consultation, which was created through a grant with SAMHSA. And so as you can see to the left side of this graphic, you'll see the qualified infant and early childhood mental health consultant that partners with the child and family providers such as teachers or home visitors to really cultivate this capacity building. Because at the end of the day, most consultants don't live and breathe. They're not a consistent component in your classroom day in and day out. Even if they are a program embedded consultant, they may only observe or support you in your classroom maybe once a month or twice a month, but you are really, the teachers are really those that hold and impact the climate, the learning environment with which the child interacts with on a day-to-day basis. So even if a consultant works with a child specifically, that may be for an hour a week, and it's really that relationship with the teacher or the parapros or the support staff that really continue to impact and influence this child's learning environment. And the consultant really helps to understand what works well and what are some things that we can continue to test out or co-create solutions that work for everyone, that are realistic, that are sustainable, that hopefully are not too burdensome, and they're not one additional thing that you have to do on your day-to-day, on the day-to-day basis. And then finally, on the right side of the slide or of this graphic, you will see that there is the impact and the connection that continues to have a positive outcome on the young children and the families that we work with and serve. And so as you can see through this triangular diagram, it's not a direct connection working with the kids. It's really supporting the adults and how they build and enhance that learning and that relationship with that young children, so that we continue to have the exponential impact in supporting you in your AM and PM session of preschool, or understanding what your career trajectory might look like. So it really is about having that ongoing continued support throughout your journey and your professional experiences. So with that, we would also, I would just very, very briefly share with you that, again, mental health consultants bring supports into natural settings where young children are. This isn't about pulling out children out of their natural learning environment that they're already used to. This is about working within the environment that the young children are feel comfortable in and they're most accustomed to. They also build the capacity of child and family providers to create nurturing environments that young children can thrive in, and then also help to promote young children succeed in their learning and relationships. The next part of this presentation I would also share is that mental health consultants support early childhood professionals and families. They provide support early on, before preschool, to really help parents and caregivers understand babies' needs and respond to the relationships in the child's life that matters, by really bringing the adults that are most important to the child to the table, so that we could really understand what is going on and what has this young child experienced before they even came to us in our classroom. Understanding and promoting trust, fostering respectful relationships with providers, families, and communities to help children at home, in preschool, and in other early childhood settings, and understanding how culture, a mixture of beliefs, values, attitudes, biases, and experiences can promote equity and shape the environments and relationships with which children experience and demonstrate with us through their behaviors. And this can also influence settings in the communities. And this is important and create meaningful ways with which we can interact with one another. So again, partner for this young child's learning. In regards to reflective consultation, you'll see that we really scaffold these learning experiences. There's 3 different main types of consultation that consultants can offer, and it begins with one level. This is programmatic, which is really at a higher level. What's going on in your school, your PFA program, across these 5 classrooms or 3 classrooms you may have? Is there an opportunity where a consultant can provide programmatic consultation to really understand how is COVID impacting your community? How is it impacting your attendance? How is it impacting how children are showing up? And we've heard that loud and clear from the field, that you're seeing more and more intense emotional responses and intense behaviors that children are expressing, and we hear you. We want to continue to partner with mental health consultants to support the educational staff so that we can help them hold on. They also offer classroom-based consultation, and this could be a co-facilitation of groups across your teachers, across the programs, to discuss generalized observations that could strategize and share successes of what's been going on in Miss Susie's classroom versus what's been going on in Miss Christie's classroom, and how we can co-create and develop solutions that might be realistic and that are helpful for the educational staff as well as administrators. And then finally, we also offer individual-based consultation, and that's understanding a little bit more if there's something going on between a dynamic of a teacher and a student, and really understand how the teacher might be responding to triggering moments or challenging situations, and what might this teacher need or this parapro need to really understand some of the situations and how they might respond to some of these big feelings that a child is expressing, or how we might be able to co-create solutions again to help children transition through the different portions of the day. And then the next part, we wanted to share a little bit about some of the common infant and early childhood mental health consultation activities. And this is something that Christy, my guest speaker, can share a little bit more about. But again, some of the common mental health consultation activities are reflective practice. And again, this can happen on an individualized one-on-one setting, or this can happen within a group setting across teachers, across classrooms, but then also having that co-facilitation and partnership with the supervisor, with the administrators. So this isn't something that a consultant is doing on their own, but this is really something that is done in partnership within the context of your program, so that it is sustainable. They provide observations, they explore and develop strategies to support children and or families. They also reflect and discuss implementation of new strategies to test out theories and to see what might help and might work. They also link to evidence-based and culturally relevant services, and also discuss programmatic supports and policies and practices that might impact the learning environment. And finally, I just wanted to kind of take you through some of how this process might work on a day-to-day basis. So once you get a consultant into your program, you would start with the initiation. You start and establish expectations and align with the philosophy of what your program might need and what they think they need from a consultant versus what the consultant can offer. And then you are able to co-create and establish a set of expectations together so that we can ensure that this is a successful partnership. Next, they will engage in exploration and explore your concerns, establish priorities and goals for the program. Then they will engage in plan development, facilitate and agree upon a plan with educational staff, parent educators, as well as administrators. And you continue to see this partnership throughout the different, you need multi-levels of engagement so that you can continue to co-create solutions that are sustainable within your program. It's not about what's available or what really good practice happens in Ms. Susie's classroom, but it's really understanding what happens at Rhodes preschool program, that's something that we could really duplicate and have a consistent learning experience for all of the children within your PFA program. And then they implement this plan. And so it's really a shared alignment of expectations with educational staff, parent educators, and administrators to implement new strategies and approaches, and also create those supports so that educators can engage in these reflective sessions. And then finally, they revisit the plan and goals, determine if it's working, if they need to update it, or adjust the plans as needed so that they can maintain the progress. The next slide really talks about some of this relational work, and it focuses on the adults in the child's life. It really brings in the lens of mental health. They work within and continue to support a nurturing environment, help to strategize with you all to think about what works, what doesn't work, think about the issues that can impact young children, and also connect with counseling or outside community mental health services when you need something that's a little bit more long-term and sustained for the family or the professional support. So with that, I'm happy to introduce Christy, who's an infant and early childhood mental health consultant, as our guest speaker that can help you and help us understand kind of what are some of the day-to-day experiences and activities with supporting her PFA program. So with that, I turn it over to Christy.
Hi, everyone. Thank you for letting me share my experiences as an infant early childhood mental health consultant. I'm a licensed clinical professional counselor and infant early childhood mental health consultant by training. I have been working with a school district and had this opportunity to work with a school district that's close to, in proximity to where I live, which is Madison County, Illinois. Some of you may not readily recognize Madison County, but it's in the southwest part of the state, kind of central, kind of southern, obviously, and it's about 20 minutes outside of St. Louis. So we actually consider ourselves a suburb of St. Louis. If you, so we align with the Cardinals, not the Cubs. So that might be a deal breaker for all you. Don't turn off the volume right now. So Christine asked me to share what a day-to-day experience might look like as an infant early childhood mental health consultant. As the role can vary greatly depending on the needs of the early childhood program, so can a typical day for me. What has worked well for the program I partner with has been classroom observations and one-on-one reflective practice with the classroom teachers. As the administrator and I kind of started thinking about this and reflecting on it ourselves, we decided that the structure would be better if we included everyone within the classroom and the support staff, which obviously includes the paras and the sub that they have quite frequently within their rooms. And at that time, because she was over, the administrator I was working with was over the prevention initiative program as well, we included the home visitors as the parent educators in the reflective practice as well. Let's see. Normally, I would spend around 15 hours a month providing these services, including prep time. There's some prep time in there. The one-on-one working relationship that I have with each of the staff members has allowed me the time and space to learn them individually, which lends itself to a deeper level of inquiry during the reflective process. Since I've been with them several years, we've built relationships, and I think that's important for this process. Initial meetings when I first met them were peppered with, how do I fix this kid? And this kid is just being naughty. And so the earlier sessions became rooted in not trying to fix the child, but seeking to understand the child. Often I use an analogy of an iceberg. The behavior is what we see along with the physical attributes, but what lies below the surface, however, is what is the behavior trying to communicate to us? That's what I seek to help them understand in those moments. Then once we explore the meaning of the behavior and what supports the child may need, a reflective conversation is initiated about what might have temporarily kept them from considering what the behavior was telling them. So they were seeing the behavior, what might have kept them from seeing the needs of the child underneath. This process brings to light their experiences, beliefs, values, attitudes, biases, and cultural preferences, and allows the time and space in a safe environment to reflect and consider how this impacts their responses to behavior that are different from their norm. This process is not about being right or wrong. It's about curiosity and awareness to build the capacities to support the social and emotional well-being of the young learners. Excuse me, I need to get a drink. Now you're probably wondering how the physical process looks in the time of COVID, because COVID is on the mind of everyone. It still is, unfortunately. The district that I support does not allow anyone in the building that is not a school employee at this time. Our one-on-one sessions have been via Zoom, and I have not been able to observe the classroom since March of 2020. I'm really glad I was able to prior to that, because it gave me a really good sense of the working of each classroom teacher and the social emotional support that they already had in place. During our sessions, other concerns have arisen due to the current environment, such as challenges of supporting social and emotional development while not being able to read facial expressions and having to social distance. Many resources have been shared during these times for both classroom and personal support. Now, some things to maybe consider that when budgeting for an early childhood mental health consultant would be like, what platform are you going to use? Are you going to be in person or are you going to be via Zoom? Because I understand the virtual world has just, I didn't do anything on Zoom prior to two years ago. So it's become an option for us. But if you do decide to be in person or a hybrid, some of the things you might need to consider would be when you go into the classroom or when you have the classroom teacher pulled out. I had a substitute teacher follow the person who is being pulled out. So that might be a consideration, having a substitute in place on that day, and a quiet space in the buildings or multiple buildings, which travel you'll need to consider too if there are multiple sites. But everything can really be tailored to the needs of the school district. I stepped into my role with the district that I help support after the grant was already in place. But if you're considering adding infant early childhood mental health consultation, the consultant might be a good resource to help develop that part of the grant. I think that would be a great collaborative relationship to find out what that your expectations as the school district or administrators might be wanting, and what that consultant, if you start with a consultant, could offer and collaborate on what that might look like when you apply for the grant. So thank you for the opportunity to share with you what infant early childhood mental health consultation might look like. And I hope that you consider using this resource to support quality mental health resources for our youngest learners, their families, and the people that support him and the people that support them. So thank you for your time.
Thank you so much, Christy, for lending us a lens into what a day of the life of a consultant might look like and how schools might consider partnering with consultants in the future. So with that being said, and again, I will remind you, yes.
Christine, sorry, it's Jenny. There is a question in there for Christy. I don't know if you wanted her to address it real quick before you move on.
Oh,
sure.
Yes, I will defer to Christy.
Yeah, it asks if I was hired as a contracted infant early childhood mental health consultant, a total of 15 hours with your district. Yes, I'm independent and I was contracted with my district. Yeah.
All righty. Thank you so much, Jenny, for that question, for flagging it for us. So quickly, we will go through some of what the research says because we want to continue to support that this is an evolving field. This is evidence informed, and it continues, and the more and more research comes out every year about the benefits, about the importance, about the value of infant and early childhood mental health consultation. So some of the benefits that you might see with young children is that you see improved social skills, improved emotional functioning, reduced challenging behaviors, and reduced suspensions and expulsions, which is something we talked about initially with our conversation. And then secondly, you also see benefits for families and caregivers. You see improved child-adult relationships. You see reduced provider stress. And even before this conversation, I was on a recent call where a member, a partner from a school district said that if it wasn't for the mental health consultant during this time of COVID, my staff would have left so quickly. It was the mental health consultant that really helped to hold the staff together and to help provide them a space where they could feel heard and process some of the challenges that they're experiencing and seeing on a day-to-day basis during COVID. So I really wanted to encourage you to think about how it's not just about the things that they do on a day-to-day basis and supporting the staff with improving their instructional time, but it's really about supporting and alleviating some of that staff and provider burnout. It's about reducing the provider stress, it's reducing burnout, and it's also reducing provider turnover, which we know is so critical with the field. We don't just want to hire a bunch of teachers, parapros, and educational staff. We want them to continue to grow with us and invest in their career with us so that they continue to partner with our earliest learners. In addition, last year, in evaluation that I alluded to in one of the other comments, Chapin Hall conducted a multi-year evaluation and really looking at the impact of the Illinois model. Could the Illinois model still hold to fidelity in the variety of settings? It's offered in home visiting settings, school-based settings, center-based settings, and as well in home visiting programs. And so what this evaluation did was to look at comparatively, they had control sites as well as intervention sites. They looked at Chicago and the surrounding areas, and they also looked at Peoria and the surrounding areas. And what they really found at the high level for this evaluation was really understanding that you need buy-in at all levels of the organization. It's not enough to have a really enthusiastic and passionate administrator that writes this into their early childhood block grants, but you also need the buy-in of the teaching staff. They can't feel like this is just one more thing that you're putting on their plate, or vice versa. You can't get a teacher that's really passionate and wants to utilize mental health consultation without the buy-in from the administrators, as Christy alluded to have that sub that's available so that she could support some of that reflective consultation of the teachers without adding one more thing to them. You really want to provide job-embedded professional development so that you can support them as they continue to grow in their career. And in addition, something else that they found was successful or impacted the success of mental health consultation was the consistent staff meetings, where we saw that, for example, in home visiting programs, they had more of a regular staff check-in. They had more reflective supervision that was already built into their program model, so that it really allowed consultation to support some of those positive practices, where some other settings, if in a center-based setting, for example, if the director that was supposed to be doing this reflective consultation with you is now having to be pulled into the classroom, you're not really going to get that one-on-one time. Really think about what are some of those programmatic themes that you're seeing within a program or across a school building that can impact the learning environment and the teaching staff and their ability or energy and enthusiasm to engage in the work. So with that, I just wanted to very briefly highlight some of the positive changes they did observe with engaging in mental health consultation. Teachers that engaged in the intervention were better able to manage children's behavior by enforcing clear, consistent, and developmentally appropriate rules of behavior and by using proactive and positive behavioral strategies. And again, with mental health consultation, we are really focusing on this promotion, prevention piece of it, as opposed to the crisis intervention, so that we could really get in and really think about how we could support our educational staff outside of a crisis so that they could be more present, more reflective, and more engaged in an opportunity when they're not as stressed or reactive in certain situations. Those that engaged in consultation are more likely to promote holistic development through a child-centered and individualized approach over time. And they also were able to observe equity, more equity in the classroom, because they were able to work effectively with diverse cultures and communities using a lens of cultural humility. And something else that you will be able to see is that there continues to be impacts even with home visitors and additional supports with parent-child relationships and some of the other settings that partnered with mental health consultation. One of the other questions that was kind of alluded to was the dosing frequency. So Chrissy shared her experience that she was contracted for 15 hours with her school district per month. And I would also share with you that it's a range. It's not a one size fits all, because depending on how many classrooms you have, do you have about 10 classrooms that you oversee, or is it one PI program that you oversee? So there's a general range of about 10 to 12 hours a month. And it also depends on multiple factors. How large is your program? How many staff do you have? How many children and families do you serve? How new is the program? Has there been a lot of turnover all of a sudden? How long has a supervisor been in their role? And these are all a couple of different factors that can impact how much time you might want to consider building in as you think about mental health consultation. And then lastly, they also had a few recommendations for the research, and also thinking about, and this is something that Christy alluded to as well in her comments, is that at the beginning, she established a common set of expectations. And they were clear, and she established a regular schedule of meetings, and also that there was a space for the consultant. As she said, she had a long-term relationship with this program, so she was able to pull on some of that historical experience before the pandemic. So she understood what were some of the opportunities to support some of the teachers in this program versus a new staff member that she hasn't had an opportunity to observe in the classroom that might impact the type of consultation that they're able to engage in. And then they also discussed the opportunity to provide booster trainings. The staff members and what they focus on in September, October is very different than their mindset in March, April, as they're nearing towards the end of the school year, and also thinking about what is that consistent structure or schedule based on staff size and within your program. You know your program the best. What works well for your program? Do you have a monthly meeting? Do you have a quarterly meeting? How can you ensure that there's that buy-in and support from the top down, from the base up, so that there's a clear set of expectations, but then also understanding what are the opportunities to partner and align in a way that fits within your program without adding something else to the daily slate. But it's really understanding how we can enhance the practices together and co-create some of those solutions. So very, very briefly, let's talk about costs. And so as I have mentioned earlier, mental health consultation is a permissible expense. And so my background's in public policy, so I really wanted to see, well, where does it say that? And what does it say? And so this is a screenshot from Illinois Administrative Code 235. You all might be a lot more experts than I am, so I defer and I will not pretend to be an expert in this. But this is just something that I wanted to pull from as an example of, for example, grants, training, technical assistance, and high quality supports. And as you can see in section 1, provide training, technical assistance, and high quality supports to recipients of funding under the early childhood block grants. And you'll see maybe the third from the bottom line where they do specifically say support for mental health consultation and research-based curricula as applicable to the early childhood program offered. So I will defer to you, and in partnership again with ISBE, we have been told or encouraged to definitely encourage you to reach out to your principal consultant. You can reference the ISBE Early Childhood website, as well as the ISBE Fiscal Policy and Procedures, and or emailing earlyshy at isbe.net as additional resources for you to explore how you might be able to amend your contract with the early childhood block grants, or what additional supports you may have with seeking and building in mental health consultation within your budget. And so one of the, yes.
Before, there's a great question in chat. I just wanted to point out, Natalie Doyle was asking, we're looking to add another infant early childhood mental health consultant, and it seems that the pool of applicants who have that appropriate credentials coupled with early childhood experiences and or knowledge is limited. Has there been further discussion in relation to workforce development? I'm aware that Caregiver Connections is hiring, but are there enough individuals to fill these positions? Great question. You're on mute, Christine.
Thank you so much. And that is the most exciting part of my presentation, where I'm going to show you the database. So here on the database, and I will screen share this. So this is hosted on Gateways to Opportunity. I just want to double check. You all can see the database? Yes, Christy?
Yes, we can.
You can see. Okay, thank you so much. So for example, I'm just going to enter a county, and that is also why I asked you where you were from, because I wanted to pull up a county that aligns with where you live. So one of those, oh my goodness, I just said it off the top of my head. One of the counties I was going to share with you, you know what, we're just going to go into Christian. I think that was one of them. And so they are in central Illinois. So on this consultant search, you can search by consultant name. You can search by program type. So you can see that statewide, state-funded PI, 0 to 3, preschool for all, early intervention, home visiting, and the consultants are able to check what types of programs that they have experience consulting or that they're willing to consult to. And so you can also filter with caregiver connections and language. So I'm just going to search within Christian County and someone for PFA. And then you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, plus more individuals that say that they are willing to provide consultation. So the thing that we do ask them on the application is, where are you willing to provide consultation in person? And we do recognize that we are in a virtual space, so there might be a little bit more flexibility with where you can get consultants, but these are individuals that have said that they are willing to provide consultation for PFA programs and to Christian County, which is located in central Illinois. And then again, we're highlighting PFA programs, but then something like, I think Rock Island was another county I searched. And then we're also able to see a few other consultants that have said that they are willing to provide consultation. And you can even see here some consultants that are able to provide consultation in English and Spanish. So these are just, it's publicly accessible. I am definitely able to share with you the link for the mental health consulting database, but this is a great resource where you can find individuals that do meet the criteria of the Illinois model for highly qualified infant and early childhood mental health consultants. So with that, I will continue with the presentation because I know that we are quickly winding down with time. Okie dokie. So with that, we do have this professional competencies rubric. So again, with the recent Chapin Hall evaluation, they did look at, they only utilize master's level mental health consultants. And based on the Illinois model and the committee that revised the Illinois model recently, just this year, they identified that individuals with a master's degree minimum, it could be in social work, counseling, psychology, marriage and family counseling or psychiatry, or if they have a master's degree in a related field such as education, child development, public health. But then there are a couple of other things that we look for that could enhance the consultant's capacity or what they might be able to contribute. And there are opportunities such as the Erickson Infant Early Childhood Mental Health Certificate, the credential with the Illinois Association for Infant Mental Health, but we do evaluate, and the current model recommends an individual that have at minimum 2 to 5 years of previous work experience working with young children under the age of 5, and also that the person have an ability to demonstrate the reflective capacity. And there's a certain amount of points that are assigned to each of these criteria, and the consultant has to have a minimum of 10 points in order to be featured on the criteria. I'm sorry, to be listed on the database. So not everyone is on the database, but on the database, we are conscious about providing you information with highly qualified mental health consultants because they've been able to demonstrate some of these characteristics. We do also recommend that all of the consultants, if your consultant has not attended the orientation, they can attend the orientation for free. It is offered 3 times a year, at least, if not 4 times a year. And again, we partner with these supports through INCRA to ensure that they're available regardless of funding stream. And then also I did walk through the database for you. So there is an approval process. If there are some consultants on this call that aren't listed, there's a link for the application as well on the website. And then from there, I also encourage you to follow us, to join us on the Infant and Early Childhood Mental Health Consultant specific webpage of GOECD, subscribe to our newsletter, and please stay in touch. Finally, should you have any additional questions, please reach out to me, Christine M. Brambilla at illinois.gov. And we do have some time for a Q&A session, so we can go through some of the questions and answer them if we have not fully answered them throughout the course of this presentation. And I'm so grateful for your time, thoughtfulness, and engagement, and for your humor engaging us in the pop quizzes, but as well as strategizing with us to help us get the video played. So thank you so much, and I am very grateful for Christy for your guest presenting as well and sharing a little bit about your experience. So one of the questions is, where can you get the orientation? So the orientation is offered virtually, and the next one is in February. So I can drop the email address for the coordinator, the professional development coordinator with INCRA, and she can connect you with the next registration process if there's room in the February cohort for the orientation.
Another question was, well, there was a statement on the iPhone, Tom, NIU has a certificate program. And then also, what is the average cost? Will they start working with a program mid-year, mid in the year? I don't know the average cost. I know that if they're an independent consultant, they will probably have a range that you guys could work out together. And I know personally, yes, I would start mid-year. I can't answer for every consultant. So I think it's just on an individual basis. And then there's another question. Oh, no, thank you for the wonderful presentation, Christine. I'm going to share the information with Lake County Early Childhood Community Coalition.
Yes, please. I'm also happy to attend with any coalitions or any other regional meetings that you think this would be beneficial. I am happy to share my roadshow and condense it as little as 10 minutes or 20 minutes, or as long as you need me to be. But I'm very happy to partner and to share more about some of the cross systems work. This has been a long time coming, and Illinois is extremely passionate and dedicated about promoting infant and early childhood mental health consultation and supporting with your early learning programs. And I would say and echo Christy's statement that yes, there are consultants that start mid-program year, that start at the beginning of the year, and it's really a range. And some of the things for you to consider is that if you have a program embedded consultant and you pay them a salary, that's a certain set of expectations. And I would assume you have benefits with them. So that's a different kind of consideration versus if you have someone that you're contracting with for 15 hours a month, but they may have like 2 or 3 or 5 other programs that they also consult with on a regular basis. So that's why we also provide that information for your consideration so that, but also if you go on the GOACD website, there's a couple of narratives or situations for you to consider and what those potential costs might be as you're building out a budget. And then I also dropped Teresa's contact information at INCRA, so you can connect with her to register for the next orientation and or the reflective learning groups as well. You do not have to go through the orientation to connect with a reflective learning group. If you have a consultant and you don't know if they are, please have them connect with us. We would be happy to connect them with the reflective learning group. It's a free support every single month, 2 hours a month for them to join the community of mental health consultants and have some of that reflective learning time as well.
And Lynn Liston is pointing out that there is a credential you can contact or get on the Illinois Association for Infant Mental Health, and looks like she'd be happy, and she puts her email in the address to, or in the chat, to contact her if you're interested in getting the credential or being credentialed.
And I would just say that the association also has reflective practice groups that are 10 months in length, and those usually start at the beginning of the year and run for 10 months. So they've already started now, but we'll be starting up more in the fall.
And with the reflective learning groups, I would also mention is that those you can enroll right now. So you don't have to start at a certain part of the year. As long as you have an eligible consultant, we'd be happy to part them and connect them with the reflective learning group that's in their community. And I think another question came up, hoping to get how to balance services, increasing services. Okay, is there any other question that we did not?
Yeah, there's one that just came in about the website, Christine, for finding a consultant. Can you give that information again?
Yes, I will put that in the chat. How to find consultants. And we have nearly 100 consultants listed on the database. So we do continue to grow on a regular basis. And we are, if there's some of you all that are in this room that are eligible to be on the database and that are not on the database, we encourage you to join us as well. Okay.
I think we've addressed all the questions, if I'm not mistaken.
And I think there was another.
Oh, so go ahead, Christine, sorry.
I was just going to say, with regards to professional development, We did want to say, and that's why we're intentional about partnering with INCRA, so that we do offer opportunities for those that are exploring or interested in being a consultant, so that they can join us. And the orientation is really a one-stop shop to kind of reset and ensure that we educate the consultants that are currently out there about the Illinois model. It was a very intentional process. This has been going on since 2016, I want to say, if not even longer than that, to pilot it, to really test it out, and then to revamp it with some of the current and emerging information that we learned from the research to ensure that we're continuing to be responsive to what information is coming out about the field and how we can continue to support our consultants. And in addition to that, we also want to provide them opportunities. We heard from the field, they didn't have access to reflective supervision, or they're really under kind of like continuous quality improvement staff, and that's not really an opportunity where a mental health consultant would receive reflective supervision themselves. So then that's why we invested in reflective learning groups throughout the state to ensure that they're free, they're accessible, and it provides an opportunity for consultants to connect with other consultants and strategize across programs, across funding streams, to see what works in a Head Start program versus what works in a home visiting program, what's unique about a PFA program, and strategize with one another that way. So I hope that answers the questions about professional development. And then there's one more message. You all are very welcome. And if there's nothing else, and once again, I will drop my information in the chat. My email address, should you have any additional questions.
And Christine, that will also be included in the handouts. So for those of you that are
Perfect.
not getting it in the chat, and I'm going to turn it over to Susie because she has those end of session announcements and also information about the next admin forum session. So thank you to you, Christine, and to Christy. Thank you so much for joining us today and providing all this wonderful information for our programs to support our mission, right, of supporting young children. So thank you.
You're welcome.
Thank you.
Okay, thank you again, everybody, and we appreciate your participation. We just wanted to let you know to please watch your email for a follow-up evaluation to complete. That will also have the recording link and the handouts from this session, and we'll also probably provide some additional links that were brought up today and mentioned so that you can have that information as well. And we just wanted to let you know that we do have some additional administrator forum sessions coming up, and you can register for those at our ECPL website at eclearningil.org. And we will be hosting the 4th session, which is on February 9th, and that is regarding family engagement framework. And then the 5th session is building inclusive preschool for all and preschool for all expansion programs, and that is scheduled for March 9th. So we would also let you know that if you've missed some of the past administrator forum sessions, they are available on our ECPL YouTube channel that you can subscribe to, which is also accessible on the website, which is again, eclearningil.org. So I think that is about it. If anybody has any additional questions, we'd be happy to stay on for a few more moments. But other than that, I think we are done for the day. So thank you again, everybody. Let's see, we have a few more messages. It could be just thanks. Yep, it's lots thanks. So thank you again, everybody. And thanks again for the teamwork in getting that video going. I ended up having to reload the whole thing, so just my tech today.